Getting pregnant after marriage starts with understanding how fertility works in both men and women. Fertility refers to the natural ability to conceive a child, and it's influenced by a range of physical, hormonal, and lifestyle factors. For women, one of the most important elements of fertility is the menstrual cycle. Each month, a woman has a fertile window, the few days when she is most likely to conceive. This window is typically the 5 days leading up to ovulation and the day of ovulation itself. Ovulation is the process where a mature egg is released from the ovary and moves into the fallopian tube, where it can be fertilized by sperm. Most women ovulate about 14 days before their next period starts, but the timing can vary depending on the length and regularity of the cycle. That's why it's important to track the cycle for a few months to understand the body's natural rhythm. For men, fertility depends mainly on the health and quality of sperm. Sperm must be present in sufficient quantity, be motile, able to swim well, and have a normal shape to fertilize the egg successfully. Factors like lifestyle, diet, and even stress levels can affect sperm quality. While women are born with all the eggs they will ever have, and these decline in number and quality with age, men produce new sperm continuously. However, male fertility also tends to decline gradually with age. Age plays a significant role in fertility. In women, fertility starts to decline gradually after age 30 and more rapidly after 35. This decline affects both the quantity and the quality of eggs. Men also experience a decline, but it is usually slower and happens later in life. Understanding this biological reality can help couples plan their family accordingly. Both partners need to be aware of their reproductive health. Sometimes conditions like polycystic ovary syndrome, PCOS, thyroid issues, or hormonal imbalances can interfere with ovulation. In men, low testosterone levels, infections, or blockages can reduce fertility. It's not just a matter of timing, it's also about ensuring that both partners are in good reproductive health. Awareness and education about how fertility works is a crucial first step in the journey to becoming parent. Timing intercourse correctly is one of the most crucial aspects of increasing the chances of getting pregnant after marriage. The key to successful conception lies in understanding when the woman is ovulating, as this is the only time during the menstrual cycle when pregnancy can occur. Ovulation usually happens once in each cycle, typically around the midpoint, about 14 days before the start of the next period in a standard 28-day cycle. However, cycles can vary from woman to woman and even from month to month, so it's important not to assume ovulation always occurs on day 14. One effective method of identifying the ovulation period is the calendar method, where a woman tracks her cycle over a few months to predict her most fertile days. Another approach is monitoring basal body temperature, BBT. A woman's body temperature slightly increases after ovulation, so charting BBT every morning before getting out of bed can help determine the pattern over time. Additionally, changes in cervical mucus can offer clues. During ovulation, it becomes clearer, stretchier, and more slippery, resembling raw egg whites. This type of mucus creates a sperm-friendly environment and is a good indicator of fertility. For those who want a more precise method, ovulation predictor kits, OPKs, are readily available and easy to use. These kits detect a surge in luteinizing hormone, LH, in urine, which usually occurs 24 to 36 hours before ovulation. Using OPKs can help couples time intercourse more accurately, especially when cycles are irregular. The most fertile window includes the 5 days leading up to ovulation and the day of ovulation itself. This is because sperm can live in the female reproductive tract for up to 5 days, while the egg remains viable for only 12 to 24 hours after it's released. Therefore, having intercourse during this window significantly increases the likelihood of sperm meeting the egg. It's important to note that daily intercourse is not necessary. Having sex every other day during the fertile window is generally sufficient and helps keep sperm quality high. While timing is essential, It's also important not to turn intimacy into a stressful obligation. Pressure and anxiety can impact both physical and emotional well-being, which may, in turn, affect fertility. Keeping the experience relaxed and loving while being mindful of the fertile window offers the best chance of success. Maintaining a healthy lifestyle is one of the most effective ways to support fertility and improve the chances of getting pregnant after marriage. Both partners play a role in conception, so it's essential that men and women take steps to enhance their overall health and well-being. A balanced diet is the foundation of reproductive health. Eating a variety of whole foods rich in vitamins, minerals, antioxidants, and healthy fats can promote hormonal balance, regular ovulation, and strong sperm production. Women should focus on foods rich in folate, iron, calcium, and omega-3 fatty acids, while men benefit from zinc, selenium, vitamin C, and vitamin E to support sperm quality. In addition to a nutritious diet, staying physically active is also important. Regular exercise helps regulate weight, reduce stress, and improve circulation, all of which contribute to healthy reproductive function. However, moderation is key. Excessive exercise, especially in women, can disrupt the menstrual cycle and interfere with ovulation. Men who overtrain may also experience reduced testosterone levels, which can impact sperm production. Aim for moderate activities such as walking, swimming, or yoga several times a week. Avoiding harmful substances is another crucial part of a fertility-friendly lifestyle. Smoking, alcohol consumption, and drug use have all been linked to reduced fertility in both men and women. Smoking can damage eggs and sperm, increase the risk of miscarriage, and speed up ovarian aging. Alcohol can disrupt hormone levels and interfere with ovulation, while drugs like marijuana and anabolic steroids can significantly lower sperm count and motility. It's best to avoid these substances completely when trying to conceive. Caffeine intake should also be moderated. While small amounts, 1 or 2 cups of coffee per day, are generally considered safe, high caffeine consumption has been associated with reduced fertility and a higher risk of miscarriage. Hydration is equally important as it supports cervical mucus production, which helps sperm reach the egg. Taking prenatal vitamins, especially folic acid, is recommended even before conception. Folic acid helps prevent neural tube defects in the baby and supports healthy cell division in both partners. Women are advised to begin taking at least 400 micrograms of folic acid daily, several months before trying to conceive. Finally, managing stress is essential. High levels of stress can interfere with hormone production and ovulation. Mindfulness practices, relaxation techniques, and open communication between partners can help maintain emotional balance during this important time. A healthy body and mind create the best possible environment for conception. Getting a medical checkup before trying to conceive is a smart and proactive step for couples after marriage. While many people assume pregnancy will happen naturally and quickly, it's important to ensure that both partners are in good reproductive health. A preconception checkup helps identify any underlying medical conditions that could affect fertility or a future pregnancy. For women, this visit typically includes a full review of menstrual history, lifestyle habits, and any existing health concerns such as diabetes, high blood pressure, or thyroid disorders. These conditions can interfere with ovulation or make it harder to maintain a healthy pregnancy if not properly managed. The doctor may also recommend certain screenings, including a pelvic exam, pap smear, or tests for sexually transmitted infections, STIs. Infections like chlamydia or gonorrhea can damage the reproductive system without noticeable symptoms, so early detection is key. In some cases, blood tests are done to check hormone levels, thyroid function, or ovarian reserve, which gives an estimate of how many eggs a woman has left. If there are irregular periods, signs of polycystic ovary syndrome, PCOS, or a family history of fertility issues, the doctor may explore these areas further to help support ovulation and regular cycles. For men, a checkup is equally important. Male fertility is often overlooked, but sperm health plays a crucial role in conception. A general health exam can help identify issues such as varicocele, enlarged veins in the scrotum, low testosterone levels, or infections that may affect sperm production. A semen analysis may also be recommended to evaluate sperm count, motility, movement, and morphology. This test can quickly determine if there are any issues that need to be addressed before trying to conceive. Doctors may also discuss family medical history and genetic conditions. If either partner has a history of inherited diseases, genetic counseling and testing may be offered to assess the risks and options. In addition to medical evaluations, the checkup is a good time to review any medications or supplements being taken. Some drugs can interfere with fertility, so doctors may recommend alternatives that are safer for conception. Ultimately, getting medical advice before trying to conceive can save time, reduce anxiety, and improve outcomes. It ensures both partners are physically ready and gives them confidence as they begin their journey toward parenthood. Taking this step together also reinforces the importance of mutual responsibility and support in building a healthy future family. The frequency of intercourse plays a vital role in increasing the chances of getting pregnant, but it's often misunderstood. Many couples believe that having sex every day, or multiple times a day, will lead to faster conception. While regular intimacy is important, what matters more is timing it correctly around the fertile window. During this time, the 5 days leading up to ovulation and the day of ovulation itself, having intercourse every other day is typically recommended. This frequency ensures that sperm is available when the egg is released, while also allowing enough time for sperm quality to remain high. Sperm can live in the female reproductive tract for up to 5 days, so couples don't need to have intercourse daily to increase their chances. In fact, daily sex over extended periods can sometimes lower sperm count, especially if the male partner has borderline fertility issues. Every other day intimacy during the fertile window strikes a healthy balance between keeping sperm supply optimal and ensuring consistent exposure to the egg during its brief lifespan of about 12 to 24 hours. There are also many myths about specific sexual positions or timing after intercourse that claim to boost conception chances. While no position has been scientifically proven to make a significant difference, positions that allow for deeper penetration may help deposit sperm closer to the cervix. However, more important than position is staying relaxed and comfortable. Some women choose to lie down for 10 to 15 minutes after sex, though this has not been definitively proven to impact fertility. Still, it may help sperm stay in the reproductive tract longer, giving them more time to swim toward the egg. Communication between partners is key during this time. Trying to conceive should not become a stressful chore, as emotional pressure and performance anxiety can negatively affect both the relationship and the body's natural processes. It's helpful to keep the experience intimate, affectionate, and free of excessive pressure. Scheduling intercourse solely based on ovulation tests or temperature readings can take the spontaneity and joy out of the experience. Ultimately, the goal is to strike a balance. Have sex often enough to catch the fertile window, but not so frequently that it becomes overwhelming. Staying informed and emotionally connected makes this stage of marriage more supportive and positive, and lays the groundwork for a healthy pregnancy journey. Knowing when to see a doctor is an important part of the journey to parenthood, especially if pregnancy doesn't happen as quickly as expected. While many couples conceive within the first year of trying, others may face delays due to various underlying issues. As a general guideline, couples under the age of 35 who have been trying to conceive for 12 months without success should consult a healthcare provider. For women over 35, it's recommended to seek help after 6 months of trying, as fertility declines more rapidly with age, and early evaluation can make a significant difference. There are many potential reasons why pregnancy might not happen right away, and both partners could be contributing factors. For women, irregular or absent periods may suggest problems with ovulation, such as polycystic ovary syndrome, PCOS, or thyroid imbalances. Painful periods or intercourse could indicate conditions like endometriosis or fibroids, which can interfere with fertility. In such cases, seeking medical help earlier, regardless of how long you've been trying, is a smart choice. For men, a semen analysis is usually one of the first tests done to assess sperm count, motility, and morphology. Male factor infertility is responsible for about 40 to 50% of infertility cases, so it's essential that both partners are evaluated. Other male issues, such as hormonal imbalances, past injuries, or infections, may also play a role. Once a couple decides to see a doctor, the evaluation process usually begins with a thorough medical history, physical exams, and basic fertility testing. This might include hormone tests, imaging of the reproductive organs, like ultrasounds or hysterosalpingography for women, and lifestyle assessments. These evaluations help identify the cause of infertility and guide treatment options. Depending on the results, treatment may range from simple lifestyle changes and medications to more advanced procedures such as intrauterine insemination, IUI, or in vitro fertilization, IVF. The sooner potential problems are identified, the more time couples have to explore effective solutions. It's important not to feel discouraged or embarrassed when seeking help. Fertility issues are common and treatable in many cases. Early medical intervention can increase the chances of a successful pregnancy and give couples peace of mind. Being informed, proactive, and supported by healthcare professionals allows couples to make the best decisions for their future family. Emotional support and patience are essential parts of the journey to getting pregnant after marriage. While the physical aspects of conception often take center stage, the emotional and mental well-being of both partners play an equally important role. Trying to conceive can bring excitement and hope, but it can also lead to stress, anxiety, and disappointment, especially when things don't happen as quickly as expected. These emotional ups and downs are natural, but how a couple manages them can significantly affect both their relationship and overall fertility journey. The pressure to get pregnant can come from various sources: personal expectations, family members, cultural norms, or even comparisons with others who conceive more quickly. This pressure can lead to feelings of inadequacy, frustration, or sadness, especially if each month passes without a positive pregnancy test. It's important to recognize that every couple's timeline is different, and that delays in conception don't mean something is wrong or that it will never happen. Open communication between partners is key. Both individuals may experience different emotions. One may feel hopeful while the other feels discouraged. Talking about these feelings helps reduce isolation and builds a stronger emotional bond. Couples should support each other, avoid placing blame, and remember that they are in this process together. Seeking emotional balance also helps reduce stress, which in some cases has been linked to hormonal imbalances that can affect ovulation or sperm production. In addition to support from each other, it's helpful to seek guidance from trusted friends, support groups, or mental health professionals who specialize in fertility counseling. Sometimes just knowing that others have gone through similar experiences can bring comfort and reassurance. Practicing stress-reducing activities such as yoga, meditation, journaling, or even simple walks can create a sense of calm and help manage the emotional weight of the journey. Taking breaks when needed and doing things that bring joy, like hobbies, travel, or date nights, can also restore positivity and keep the relationship strong. Ultimately, patience is key. For many couples, it takes time to conceive, even when both partners are healthy. Staying emotionally resilient, nurturing the relationship, and maintaining a hopeful mindset will not only make the process more bearable, but also help create a peaceful and loving environment for the baby you're hoping to welcome into your life.